the global trends are very interesting because we just recently published a review on the global incidence and mortality of patients with myeloma. And what you see is an underreporting of patients with myeloma in many parts of our globe. So you see high incidence in countries with excellent healthcare systems, not only excellent healthcare systems, but you have also to have easy access to healthcare. So in those countries, myeloma is diagnosed readily and early, and you have a higher incidence, but you don't not only have a higher incidence, you have also a much better overall survival as compared to many areas on the globe where you have low incidence rates. And these are not only due to genetic factors, environmental factors, lifestyle factors, but this is mainly due to, let's say, suboptimal healthcare which is available to the population, because if the healthcare would be optimized, you would diagnose many more patients with MGUS, smoldering myeloma, and multiple myeloma. So we have a problem, a global problem, which is not only specific for myeloma, but when we analyzed this data, it was very, let's say, prominent. And so we have to accept that the presently estimated incidence rates of 160,000 myeloma cases per year are a gross underestimation of the real incidence, global incidence. And and the prevalence is thought to be about 550,000 patients, but that is also an underestimation. So we need to improve, which is logical, the quality of healthcare and the access to healthcare in order to diagnose patients with myeloma early on, and all those patients suffering from myeloma, in order to improve their outcome, because with better quality of healthcare, of course, there comes better management and treatment and better outcome. But what we also see is access to novel drugs, which is, of course, a major problem for the global myeloma community, because we can estimate that about 80 to 90% of the patients don't have access to the novel drugs, or the majority of novel drugs. So their treatment is suboptimal, also in terms of drug supply. And this is another issue for which I don't have a good solution to, but we have to realize that that is the reality as of today.